Good afternoon. I'm Commander Anna Kahn, Associate Director for Communication with the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome you to today's EH Nexus webinar, Radon Awareness Week, National and State Level Radon Risk Reductions Initiative. This EH Nexus webinar is part of Radon Awareness Week. There will be a presentation and a Q&A session with panelists. All participants joining us today are in listen-only mode. Closed captions are available for this webinar. Next slide, please. Today's EH Nexus webinar will be available to view on demand a few days after this webinar. You can find the video recording of today's webinar at CDC's EH Nexus webpage at cdc.gov/NCEH/EH Nexus, or you can scan the QR code. Next slide, please. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen, then type your question in the Q&A box. Please note that we usually get more questions than we can answer during a live session. If you're a member of media and you have a question, please contact CDC Media Relations at media@cdc.gov or at 404-639-3286. Next slide, please. Please note, the findings and conclusions of this report are those of the authors and do not necessarily represent the official position of CDC. Next slide, please. I would like to welcome our presenters for today's EH Nexus webinar. We're pleased to have with us Catherine Pruitt, National Senior Director of Policy at the American Lung Association, and Jessica Maloney, Indoor Air and Radon Program Manager for the Wisconsin Department of Health. And now I'd like to turn it over to Ms. Pruitt. Ms. Pruitt, the floor is yours.
Thank you very much. And it's a pleasure to be here. And I'm delighted to have all of you attending to listen to our information about the National Radon Action Plan, history, progress, and future opportunities. Next slide, please. Before I jump into details about the National Radon Action Plan, allow me to take a minute to give you some background about radon and about why we care about it as a public health issue. Radon is a naturally occurring radioactive gas that is a breakdown product of uranium in rocks and soil. Sometimes radon gas enters homes and other buildings through cracks in walls, basement floors, foundations, and other openings where it can then be found at high levels. This colorless, odorless gas causes no immediate health effects, but over time, the radioactivity it releases can cause lung cancer. Radon is the second leading cause of lung cancer after smoking, and the leading cause of lung cancer among non-smokers. Radon-induced lung cancers cause an estimated 21,000 deaths in the United States each year. Unfortunately, because of the nature of this quiet killer, public awareness of radon as a serious health risk is low. But the opportunities for the public health community to take protective action through policies and programs is high. That's why the National Radon Action Plan was developed. In my time at the Lung Association, I've been involved with the development and implementation of similar national plans on other lung health issues. And they have a couple of attributes in common that contribute to their success. A strong national plan is developed through a consensus process by a diverse group of stakeholders, including government agencies, nonprofits, and professional societies. It lays out clear objectives and strategies for achieving them. It gives stakeholders a to-do list to refer to and gets advocates focused in the same direction. And it's not the job of any one agency or group to execute. It's the shared responsibility of everyone who cares about the issue. The National Radon Action Plan is organized into 4 key priority areas: building protection into laws and policies, expanding financial incentives and support for testing and mitigation, increasing the capacity of the radon workforce, and increasing awareness of the health risk and control strategies. Next slide, please. Implementation of the plan is overseen by a leadership council made up of representatives from 14 member organizations that include government agencies, nonprofits, and professional societies. The Lung Association's been honored to serve as a convener of the Leadership Council since its inception, and EPA provides much of the funding that supports the work of the group. Next slide. The first 5-year action plan was launched in 2015 and ran through 2020. It was the first time that the National Stakeholder Group came together to agree on priorities for action. The plan set a bold goal to mitigate 5 million high radon homes and save 3,200 lives annually by 2020. When we sat down to calculate the outcomes at the end of the 5-year period, we were able to see some real life-saving successes, but we had to recognize that it was in fact difficult to translate into firm numbers of homes mitigated and lives saved. But cancer prevention, which is the business we're in, is playing the long game in terms of lives saved. We know that we at least came close to achieving our goal, if not actually exceeding. Some of the advances in radon risk reduction that occurred in the previous 5-year plan include integration of radon requirements into some HUD programs, including adding guidelines for federal mortgage insurance for multifamily housing. Accreditation standards for testing and mitigation that have been adopted in HUD's multifamily housing and residential care facilities. More certified radon professionals are available nationwide, and some progress has been made in engaging medical, public health, and child care leaders as radon stakeholders. There were also many legislative and policy successes at the state and local level that have helped advance our goals. Next slide, please. Last January, we released the new 5-year National Radon Action Plan, which covers the years 2021 to 2025. The Leadership Council took the same approach to drafting strategies and outcomes for each of the 4 priority areas, which have remained essentially the same. Many of the strategies are also unchanged or have been revised just slightly to reflect changes in the current environment. We thought it was important to continue to build on successes in areas where we had gained momentum. But we also took a hard look at some of the unmet needs and added or revised our strategies to address them. These new areas of focus are what I call emerging themes, addressing radon in all buildings, not just single-family owner-occupied homes. Increasing emphasis on health equity, making sure that we're reaching underrepresented groups and reducing barriers to accessing radon risk reduction, and using data to drive decision-making so we can better target our efforts and track our results. Next slide, please. Now I want to give you a brief tour of the strategies in the new plan and highlight some of the areas where the NRAP Leadership Council is most active and where I think there's an important role for regional, state, and local stakeholders like yourselves. Note that I've paraphrased the wording of the strategies to fit on the slides, but you'll get the idea. Priority 1 is about institutionalizing radon risk reduction through policy and systems change. Here you can really see the increased emphasis on radon in all buildings over the first 5-year plan. In strategy 1.1, we want to see all real estate and rental transactions include information about radon health risks and disclosure of radon test results. This is an area where we've seen some good steady progress in states around the country, but there's a lot more that can be done to take advantage of the teachable moment of a real estate transaction to protect homeowners and tenants. Next slide. In strategy 1.2, we want to see private, quasi-public, and government lenders require radon testing and mitigation in all residential, educational, and commercial buildings that they fund. At the national level, the National Radon Action Plan Leadership Council has been working for several years to get the Federal Housing Finance Administration to include testing and mitigation requirements in their mortgage lending, first for multifamily housing, and then starting a push for single family. Next slide, please. In strategy 1.3, we want to see state and local building codes require that all buildings be built radon resistant. And next slide, please. And in strategy 1.4, we want to see a robust, comprehensive set of local, state, and federal policies and codes that require all existing buildings to test and mitigate as needed. We believe that building owners and managers, employers, school districts, and daycares should be expected to ensure that radon levels in their buildings are protective of occupant health. I think schools and daycares are a place where we can make a lot of progress at the state and local level. There are some good, strong laws on the books that can be used as models in places that don't have testing requirements in place at the moment. In fact, our next speaker will be talking about a recent success in Wisconsin. Next slide, please. So in addition to strengthening laws and policies to institutionalize radon risk reduction, we know it's important to support radon risk reduction by removing barriers to accessing testing and mitigation for low-income homeowners and tenants, which is what the strategies in Priority 2 are all about. Pardon me. This is an area where you can see our sharpened focus on health equity. In strategy 2.1, we want to see property owners able to obtain financing for radon testing and mitigation in low-income housing. Some of this can't happen without increasing the number and diversity of the funding streams, which has always been a challenge. But we're also talking about making an effort to ensure that property owners in under-resourced communities know about existing funding mechanisms and know how to access them. There are a lot of different programs available at the national, state, and local level, and the NRAP Leadership Council is working on compiling an inventory. Next slide, please. In strategy 2.3, we want to see local, state, and tribal programs that exist problems in existing housing, such as housing rehab, home repair, energy upgrade, and weatherization programs, include radon testing and mitigation in the services they provide. This is another area where the NRAP Leadership Council is gathering information about what's currently happening in communities. Then we can figure out where the opportunities are and work with stakeholders to forge relationships with those programs to deliver enhanced services. Next slide, please. In strategy 2.4, we want to see all state cancer control programs, which are funded by the CDC, include radon risk reduction interventions in their primary prevention strategies for lung cancer. If you don't know what's going on in the cancer control programs in your or cancer coalition in your state, I encourage you to look into it and make sure that radon is included. Next slide, please. Radon risk reduction depends on good data and a sustainable workforce of trained and certified measurement and mitigation professionals. Priority 3 is all about capacity building. This is the component of the National Radon Action Plan that's probably changed the most, in large part because of the opportunity to build on some of the successes in the previous 5 years. We also recognize that if we're successful in our goal of increasing the places where testing and mitigation are required, We're going to need a larger, well-trained, and certified workforce to fill that need. In strategy 3.1, we want to see more testing data available to decision makers nationwide for use in characterizing radon exposures, setting priorities for policy action, and determining the need for additional capacity. The CDC Environmental Public Health Tracking Network is the best publicly available data set on radon test results, but only some states and testing companies are contributing to that database. CDC is able to provide assistance in terms of data transfer for states and labs that are interested in contributing. And we really encourage the addition of that additional data. CDC would like to work toward a goal of being able to display radon data, which is currently available aggregated at the county level, at the census tract level, but they need more data to be able to get there. Next slide, please. Strategies 3.2, 3.3, and 3.4 are all focused on ensuring that radon testing and mitigation is done according to the highest industry standards of practice, and that the work is done by trained and certified professionals. We want to see all states adopt a program for oversight and credentialing of radon service providers, something that only 20 states do currently. Taken together, these three strategies will protect consumers from fraudulent practices, save lives, and provide support for the reputable businesses that are already out there. Next slide, please. In strategy 3.5, we want to see enough credentialed radon professionals available nationwide to meet the increasing demand for testing and mitigation. Next slide. Priority 4 continues to be about awareness raising, as it was in the previous plan. But the strategies in the new plan are more focused on specific audiences rather than on the general public. Specifically, the strategies target decision makers and intermediaries who have a responsibility and influence over the health of the people they serve. In strategy 4.1, we want to see decision makers with responsibility for occupant health in housing, schools, and workplaces include radon risk reduction in their policies and practices. This year, our focus has been mainly on schools and daycares. We want to capitalize on the increased interest in improving ventilation and indoor air quality that's come out of the pandemic, combined with the influx in COVID relief funds that are available for school infrastructure improvement. Next slide, please. In strategy 4.2, we want to educate more non-traditional radon stakeholders, such as health equity, faith leaders, and social service providers about radon and how they can equip their constituents with the resources they need to take radon risk reduction action. This year, we've been making a push to reach out to healthcare providers, and we have some great resources available for that if you're interested. Next slide, please. And lastly, when we're talking about risk communication, which is a critical component of radon work, one size does not fit all. In strategy 4.3, we want to ensure that tailored, culturally competent messaging and awareness materials are reaching underrepresented communities. We know that a lot of states and tribes have developed some of their own resources for targeted audiences. The NRAP Leadership Council is in the process of collecting information about what's out there with the intention of creating a clearinghouse of shareable materials. That will also help us identify and fill gaps. Next slide. Well, that wraps up my whirlwind tour of the strategies of NRAP 2021-2025. I hope you heard a few things that piqued your interest and that you might consider looking into more closely. Our hope, of course, is to make significant progress in all of our priority areas in the next couple of years. But if I had to personally highlight a couple of places where the opportunity to make significant progress is particularly promising, I'd probably start with these 4. Building in protection for tenants, supporting testing and mitigation in schools, increasing state requirements for credentialing radon professionals, and raising awareness in underserved communities. The text in blue under each of those areas gives you an idea of a recent success that we maybe have had in this area, or a particular aspect of the opportunity that's in front of us. Next slide, please. There are lots of available resources about all aspects of radon control, radon risk reduction. Many of the member organizations of the NRAP Leadership Council and the state radon programs have lots of information and resources, including these items in blue that you can find on the American Lung Association's website, lung.org/radon. That's all from me for now. I'll look forward to your questions, and I will turn the floor over to our next speaker to share what she's been doing in Wisconsin. Okay.
Thanks, Catherine. And hello from Wisconsin. Thanks for inviting me to talk today about Wisconsin's radon program. I'm really fortunate to have worked in Wisconsin's state indoor radon program with a grant from the US EPA for over 10 years and as part of the Wisconsin Department of Health Services. So I'm fortunate to have had the opportunity to develop the program and learn the complexities of working in environmental and public health systems, and to highlight radon as an issue. Wisconsin's recently been gearing up for implementation of a child care licensing rule, which I'll talk about today, and that licensing rule, which includes radon. And I'll also discuss some of the radon projects that our Native communities have been implementing in the past couple of years. Next slide, please. So to give you a little perspective, based on our test data, at least 1 in 10 homes in Wisconsin have elevated radon levels. The EPA action level for radon is 4 picocuries per liter, and the picocurie per liter is the unit of measure for radon results in the United States. Radon levels should be reduced if they're at least 4 picocuries per liter or higher. However, we know there's still an increased cancer risk from breathing radon at levels under 4. So we do recommend considering action when radon levels are between 2 and 4. The action level was established in the 1980s, and today, radon mitigation professionals can typically get radon levels below 2 picocuries per liter. Next slide, please. The US EPA has created a map of the various radon risk zones, and the map of radon zones was developed in 1993. It was to identify areas of the US with the greatest potential for elevated indoor radon levels. So it's based on indoor radon measurement data, geology, area radioactivity, soil parameters, and foundation types. You can see from the map that zone 1 is red and is the highest radon risk level. Zone 2 is orange with a moderate risk level between 2 and 4 picocuries per liter, and zone 3 is a lower potential. So Wisconsin's circled there and shows that we are largely in a zone 2 state. We are also a Great Lakes state. Next slide, please. You advance to the next slide. Thank you. So Wisconsin's been collecting radon test results for a number of years, and we've designed a more detailed risk map, which closely matches the one that I just showed you from the EPA. And it shows us radon's pretty prevalent in Wisconsin. And again, we're a zone 1 and 2 state. This map here is particularly, it is interactive, and you can find it on our website, our state website, which is lowradon.org. And you can zoom in and out to particular areas on the map to look at the test data that we've collected over the years. And the blue dots on the map indicate our local radon information centers. These centers are staffed by public health departments and serve area communities as a resource on radon. Our EPA, state, and our radon grant funds support local outreach and education efforts across the state, with these individuals acting as local hubs. So they offer low-cost radon test kits and education on radon testing for their communities. So maps can be a really great tool, but they can also be kind of deceiving in the radon world. So this map is intended to show areas of risk. So you might look at the lighter colored areas and think, oh, you don't have a radon problem. However, the only way to really know if your residence has radon is to test for it. So this concept can be kind of challenging to explain when we use maps to show risk. However, our outreach work really targets areas that we know that have higher risk based on testing. Next slide, please. So since Wisconsin is a state with higher risk, it's integral to build awareness and protection for all of our people. So given our understanding of risk, our partners statewide are also recognizing their roles in protecting each other. As a result, the Wisconsin Department of Children and Families began reaching out to their licensees and updating their own regulations that make child cares safe and healthy places. So in 2022, the Department of Children and Families updated their child care licensing rules to include radon testing and mitigation. And beginning March 1st of this year, all licensed daycares will be required to test for radon and mitigate if the levels are found at or above 4 picocuries per liter and the lowest level used by children for at least 7 hours per week. Next slide, please. The licensing rules are pretty consistent for residential versus commercial daycare settings. However, commercial settings will be allowed to test every 5 years and residential every 2, and that's part of the standard. We're recommending but are not requiring that facilities follow the standards recognized by the National Radon Proficiency Program for residential and commercial buildings, which includes a certified contractor, includes using a certified contractor. So Wisconsin doesn't have any certification laws requiring contractors to become certified or licensed to perform mitigations or testing. However, we're really stressing in our outreach to use certified individuals because it's really the best practice and recommended for those for best results and to avoid overpaying for inadequate systems. Next slide, please. So there are 2 state agencies partnering to support those groups that are affected by our rule. DHS traditionally provides training on radon to the public and private sector and will continue to do so with our focus plan for daycare providers and their licensing staff, and then giving more opportunities for contractors to obtain training and certification on radon. So the Department of Health Services has created a website for child care providers with frequently asked questions and guidance that will continue to be developed over time. We've created some webinars and we'll be doing some more training this coming February for daycare providers themselves and the licensing specialists. We already started some training this past December for licensing specialists on measurements, and we'll get more into what mitigation systems look like for those licensing staff, so they have a very kind of well-rounded idea of what's involved with radon testing and mitigation. And we'll continue to refresh those staff over time and continue to update new providers over time as well. We'll have lots of videos and recordings on our website specifically for providers and those looking for more information. The DCF licensing staff will then be checking test records and ensuring mitigation systems are installed when action levels have been exceeded. So fortunately, there's also some temporary funding to support mitigations. Next slide, please. Through the Child Care Counts program, which is Payment Program A, increasing access to high quality care funds. The Child Care Counts program is a limited time payment program designed to provide assistance to childcare providers in response to the COVID-19 public health emergency. So childcare providers and owners will have to apply for this funding individually. More information can be found at that web link on the slide on this payment program. Next slide, please. So we'll have our set of challenges, that's for sure. So since certification is not required for contractors in Wisconsin, we will have to do a lot of education and outreach to the public on the best practices and guidelines. And there are a limited number of contractors in Wisconsin, so we'll be offering more reduced cost training opportunities to further develop our workforce and introduce more contractors. However, in 2023, I think we're just going to be largely focused on improving knowledge, skills, and abilities, and further developing our strong radon workforce. Next slide, please. So let's start to talk more about our radon projects in Wisconsin Native communities. Next slide, please. So Wisconsin is fortunate to be home to 11 federally recognized tribes. You can see their seals overlaid on our Wisconsin map relative to their location in our state. And just as a reminder to our audience today, that tribes have sovereignty, which means that Native communities have the right to govern themselves. So as a state agency, we have a government to government relationship with tribal leadership, and we need to work hand in hand with tribal members and leaders when working on programming or outreach that impacts our Native American Wisconsinites. Next slide, please. So as mentioned previously, funding for mitigation systems can be a consistent issue. However, Wisconsin Department of Health Services has found some partners with funding resources that we rely on. And we've coordinated some testing projects in partnership with the United States Department of Agriculture. They have a single family housing repair loan program, and it's also a grant program. And we've used this program to work with the United Nations a couple of years ago, where the Wisconsin Radon Grant funded test kits for about 150 tribal residences in the United Nations. And then the USDA program funding supported a few mitigations for some low-income members. So I really encouraged states to review this funding source, not only for radon mitigation support, but for many of the environmental health hazards encountered in homes. Their focus is on rural homeowners, which can be a population that's really hard to reach with resources. So they've been really great to work with and are usually a wealth of knowledge about funding for low-income homeowners. Next slide, please. And keep going with the clicking. Thank you. So Wisconsin Department of Health Services has partnered with the Wisconsin Cancer Collaborative to include radon as a priority. So as a result of this collaboration, we've engaged in supporting the Stockbridge-Muncie Band and testing their reservation and securing funding to install mitigation systems. The Wisconsin Cancer Collaborative was able to secure private funding to support hiring a contractor to install mitigation systems for this project. This effort is really taking momentum, and other tribal networks are learning how to engage their members based on some of the successes we've had working on the project together. Hopefully, Dr. Noelle LeConte and Beth Brunner's team at the Wisconsin Cancer Collaborative are listening today, and they've been excellent partners and overall just wonderful humans to work with and elevating radon from a cancer perspective in Wisconsin. Next slide, please. So I'd like to get a little more in depth about the project we've been working with the Stockbridge-Muncie tribe and the Wisconsin Cancer Collaborative on. Next slide. So for a little bit of perspective, again, the tribal seals are used to indicate the location of tribes in the state. And it's overlaid with the radon risk map for Wisconsin. And you can see the Stockbridge-Muncie lands are circled in red on the map, and they're largely in a high-risk area. So it's good that we've been getting this project going. Next slide, please. Just for a little bit of background on the Stockbridge-Muncie tribe. I've learned through visiting with the Stockbridge-Muncie and reviewing some of their materials and literature that they are originally from the eastern United States and have made several moves, being forced to resettle several times. So after Europeans arrived, disease and warfare killed many of the Mohican people, and many of the survivors ended up leaving New England. They eventually settled in Wisconsin, where the Stockbridge Mohicans still live today. There are also small Mohican communities remaining in New York and Massachusetts. The Mohican Reservation is shared with the Muncie tribe, and together they're known as the Stockbridge-Muncie. They have this name because the Mohicans are also known as the Stockbridge Indians, after a town in Massachusetts they once settled in. Their people were known for settling near riverways where they would build wigwams, like the structure pictured here. It's a circular structure made of bent saplings and bark, and the roofs were covered in bark, and holes were cut to allow for smoke to escape. The Stockbridge-Muncie are a major employer in Shawano County, and over 1,800 members reside, and 26% of them live on the reservation. Next slide, please. So the goals for the outreach and education project within the Stockbridge-Muncie community was to build awareness, test the homes on the reservation, and install mitigation systems where there's a need. So the Wisconsin Cancer Collaborative have been an integral partner in facilitating this work. Dr. LeConte and Beth Bruner have a special relationship with the Stockbridge-Muncie medical team, and the Stockbridge team has been awesome to work with, and Dr. London, Vera Hubel, and Tony Turlot have been great resources for their community, and they continue to reach out and advocate for their communities for radon. And radon has really become a significant interest to their tribal leadership because of the number of members with lung cancer, and their location is known to have elevated radon based on our risk maps. So the Wisconsin Cancer Collaborative and the Stockbridge-Muncie staff reached out to me just for support on creating a plan and finding some resources for test kits and mitigations and general ideas for outreach. We all met and discussed options for getting started. So as a result of some of our planning and discussions, one Stockbridge-Muncie member was trained on testing and mitigation basics, and they're also considering sending another person to training in order to support maintenance and future installation needs. The Stockbridge-Muncie also obtained a grant from the US EPA to obtain some test kits for the reservation and improve awareness. And the Cancer Collaborative obtained some private funding to support installation and mitigation systems. We've met with physicians and the Cancer Collaborative up on the Stockbridge-Muncie lands in November and discussed the issue of radon and how to test for it. And we're going to continue to work with them and talk with community members about radon and how to fix it moving forward in the future. Next slide, please. So word is spreading on the importance of testing for radon, and that's a really good thing because at this point, we're seeing some results come in, and about 67% of the tests returned are coming back with elevated radon levels. Fortunately, those mitigation systems, there have been mitigation systems installed in at least 13 of the 19 homes that were elevated. Some of my data might be a little bit outdated as they're still moving quite along with this project. So project's not over, we're just getting started. And there's a few outliers that are still pending. One person ended up doing their own mitigation. So they're still moving forward with plans to expand support for their members. But I can say overall, from my own perspective, things that have worked well so far is just establishing a relationship through a trusted community partner. The Cancer Collaborative and Dr. London and their staff have been wonderful resources to work with. And they really connect the community with resources. And I've worked with them on connecting them to resources that they're eligible for. And the Wisconsin Cancer Collaborative funds have helped remove barriers to mitigation. Overall, just using a trusted community leader to help do outreach and education about the risks of radon and the importance and convenience of testing is really an essential part of what makes this whole thing work. Next slide, please. So that about wraps up my summary of our Wisconsin work with our upcoming radon regulation and some of the highlights of the projects we've been working with Native communities across the state. There's more to come. And at this point, I think I would like to hand it back to Anna.
Okay. Thank you. Thank you, Ms. Pruitt and Ms. Maloney, for providing our audience with this important and timely information. Now we'll go ahead and go over into our Q&A session. So to ask a question using Zoom, click on the Q&A button at the bottom of your screen, then type in your question in the Q&A box. Please note we usually get more questions than we're able to answer during a live session. And also, if you're a member of the media and you have questions, please contact CDC Media Relations at media@cdc.gov. Or you can reach them at 404-639-3286. Now we'll go on over to our first question. We have a lot of questions. So here we go. This first question, Catherine, is for you. And the question is, these initiatives are great. I would appreciate it if you can provide a recording of this program or a PDF. So just to let all of you know, this recording will be available on EH Nexus after this webinar a few days later, and the slide deck will be as well. But Catherine, please also let them know where they can find the initiatives that you were talking about.
Okay, there is a page about the National Radon Action Plan on the Lung Association's website, which is lung.org/radon. The EPA, you can also find the plan, I believe, on EPA's website and Radon website and on CDC's Radon website.
Thank you. And Jessica, this next question is for you. Are the newer direct read radon testers good enough? I am still using the 48-hour minimum. I have used longer 9-month test once. Which one is best and which is allowed?
Good questions. The recommended testing protocol is using a short-term test kit, and if you or a long-term test kit, but I'll start with short-term. If you're going to use a short-term test kit, it's typically 2 or 3 days, and if the first result comes back elevated, then we recommend a second test just to validate that test result, because it's just a snapshot in time, really. It's not related to your overall exposure. So that gives you an idea if radon might be an issue. And then the longer term test kits which can be put out for a minimum of 30 days and in place for up to a year. Those are a great indicator of your overall exposure and can reflect your exposure for how you use your home. Now, there are a lot more of those smaller devices for in-home everyday use that are out there from a variety of vendors that I can't really recommend one over another at this point in time. They're still being reviewed for whether or not they would be an approved device. I'm not aware of if any of those are considered, an approved device by the national certifying programs that are out there. And a lot of things, one particular item I'd like to make note of for folks is if they're using some of those instant readout devices, is that there may be some calibration or resetting instructions that a lot of people maybe miss. And so the results might be not quite as accurate, or you might be just getting like a rolling average versus what your result is at that point in time. So hopefully that makes some sense.
Thank you. Thank you, Jessica. The next question is for Catherine. Can you address your group's role in other home contaminants such as carbon monoxide and carbon dioxide?
Well, the Lung Association has been I would say, one of the organizational leaders on healthy indoor air for decades, and especially around the contaminants that affect lung health, as you might imagine. In addition to radon, we've been very active in secondhand smoke and in the indoor air pollutants that are linked to that are considered asthma triggers. So those are really the areas where we have both educational materials and some policy priorities.
Thank you. Thank you, Catherine.
Mm-hmm.
Jessica, this one is for you. What are the challenges and strategies used to navigate around the challenges in order to get the new child care facility rules enacted?
That's a really good question. Our child care rules were basically developed by the Department of Children and Families. So not the department I work for, which is the Department of Health Services. And they were able to reopen their licensing rules for updates. And kind of an important note there is when they made an update to those rules, they also included some other environmental and public health issues like testing for lead and water and nitrates, I believe, as well. So my understanding as far as rule writing goes, it's somewhat easier to revise an existing rule than to create a new rule from scratch. So that is my limited understanding there, but we're really pleased to have some movement and recognition of radon as an issue by another department, and also that it's protecting some of our most vulnerable people at the beginning part of their lives, as well as those who are working in those environments.
Thank you, Jessica. Catherine, we've got a couple of questions about mitigation, so I'm going to give you these two questions together if you don't mind taking them. The first question is, are there any obstacles to accepting mitigation when radon levels are found to be high? And then the second question is, will there ever be a push for mandatory mitigation?
I'm not quite sure I understand is it accepting mitigation, Anna?
That's correct. Are there any obstacles for accepting mitigation when radon levels are found to be high? So I think this is about if if homeowners or facility owners make a decision for radon mitigation, but yet there's not the funding there for it, what can we do to move forward with mitigation?
Oh, okay. Well, it is true that for some families, the cost of mitigation, which is not large by home improvement standards, but is still significant for some families. We talk about the average cost of radon mitigation being around $1,500. And any of you who've been in a position to either need a new roof or a new furnace or choose to do some more cosmetic home improvements, you'll know that that's not very much. But there certainly are families for whom that is unattainable. And there, as I mentioned in my presentation earlier, around the need to expand existing sources for financing for mitigation for people of lower income, there are a variety of places that people can look to attain that financing, but it's hard. It can be hard to find. And that is something as advocates and as decision makers, I think it's incumbent on all of us to work to improve that situation for lower income homeowners. It looks like Jessica has something to add in that regard too, which I will welcome.
Thanks, Catherine. There are a number of states that have a radon program specialist that can help direct people to resources in their communities that support radon mitigation funding. Sometimes there's housing and urban development programs that can support healthy home initiatives, of which radon is one of them. There might be community development block grants that have covered radon systems in the past. And so there are some options out there. And I think with Catherine's leadership, we are moving in the right direction towards finding more resources for those vulnerable populations as well.
Thank you. Thank you, Catherine and Jessica, for answering those. The next question, Jessica, is for you. It's on average, how many radon tests are being conducted annually in Wisconsin, or at least annual tests over the last few years?
That's a really good question, and I should have it top of my head, but I'm going to ballpark. Our average has been, if you're just talking about testing, in recent years, we've seen anywhere from over 10,000 tests per year, and that's collecting data from all the labs in the United States. Our radon program specifically tracks those tests that we facilitate. And typically we facilitate about 30% of those overall tests performed in Wisconsin. So with our outreach through local health departments statewide, they are really that hand in the community that gets test kits out to people as well.
Thank you. Thank you, Jessica. Let's see, the next question is, Catherine, it's for you. Can you please emphasize the short-term testing? For example, the 3-day charcoal canister, laboratory limits of detection, the percent error in these results, and the need to follow up if the results are greater than 4.0 with the longer term testing to verify the result.
Well, certainly that is exactly the protocol, and Jessica kind of talked us through that a few minutes ago. One of the ways in which the short-term test kit is used, as a first option and is very important is in the real estate transactions that I talked about. We know real estate transactions are a kind of a time-sensitive type of interaction, and they're really usually we do want to see radon testing take place in that time period, so that the sellers and the owners know their radon levels and can negotiate together how to get those fixed. So that's the situation in which that short-term test is important, but we do want to make sure that there is follow-up on that first round of results if the levels are high.
Thank you, Catherine. We have time for just one more question. And this last question is for you, Jessica. Is there any radon mitigation funding for homes that are rented, not owned? I'm from the Oneida Nation, and we are actually not able to find funding to address radon issues in homes where the residents are renting.
That can be a tricky one because it is up to the landlord, the building owner, to take action in those cases. So there would have to be some work with the landlords in that area to see what sort of resources they might be eligible for. I think I would work with the USDA funding that I mentioned before as a start, because they focus on rural areas of the state. But I don't know if I take that back. It might not be for renters, but if the landlord were to apply, they might qualify for that funding resource. But I'd love to talk with you more. If you want to reach back to me, we could potentially talk more about your issue in particular and see if there's some more local resources that might be available to help. But in general, renters should be working with landlords for mitigation purposes.
Thank you, Jessica. Well, this concludes our Q&A session, and it concludes today's EH Nexus webinar. Thank you for joining us, and a special thanks to Ms. Pruitt and Ms. Maloney for presenting. Take care and have a great day.